Hi, my name is Maria. I'm going to be your provider today. Can you tell me your name and your date of birth?
Alina Rabinovich, 6193.
Okay, I'm going to be doing a physical exam on you today, if that's okay.
Yes.
Alright, I'm going to be starting by assessing your skin. I don't see any redness, cyanosis, rashes, or lesions. I'm going to test the temperature. Okay, it's warm to touch and dry. I'm testing the skin trigger now. Okay, you have good skin trigger. Moving on to your skull. Your head is normal cephalic in shape. There's no masses, no deformities. It's traumatic. Tell me, I'm going to palpate now. Tell me if you feel any tenderness.
No.
Okay, your scalp has no lesions or masses either. Your hair is coarse and evenly distributed. I'm going to palpate your temporal arteries now. Any tenderness?
No.
Okay, they're too close bilaterally. Now I'm going to continue to inspect your face. Your face is symmetric. Can you smile for me? Okay, now pop out your cheeks and raise your eyebrows. Okay, your cranial nerve number 7, your facial nerve is intact. Now I'm going to continue and inspect your eyebrows. They're evenly distributed. The hair is evenly distributed on both sides and they're symmetric. Your eyelids are symmetric bilaterally. There's no edema, no redness, no rashes. Your sclera is white. Your irises are green and well defined. Your pupils are 3 millimeters in size. Lateral and medial campuses have no excessive drainage or crusting. Your lacrimal system is intact. I'm just going to pull down your check your conjunctiva. Okay, it looks pink and moist bilaterally. No jaundice. On your face, there's no excessive hair growth either. I'm going to do an eye exam and test your visual acuity with the Rosenbaum chart now. We'll hold this 14 inches away from you. And then cover one eye, read the smallest line that you could see.
LTFPH.
Now the other eye, cover and read the smallest line. If it's the same one, read it backwards, please.
LTFPH. Oh, sorry, HPFTL.
Okay, now uncover both eyes and read the smallest line you could see backwards. I'm sorry.
Frontwards, sure. LTFPH.
Okay, your visual acuity is 20/20. According to the Rosenbaum chart, your cranial nerve number 2 is intact. Now I'm going to do a series of pupil. I'm going to continue with my eye exam and test your pupillary reflexes. You want to shine a light for direct light reflex in your pupils. Okay, constricts. Your pupils are responsive to direct light. Now for consensual, I'm going to look at the other eye, opposite eye. Okay, the opposite eye constricts. Opposite eye constricts, but they're reactive to consensual light. Now for accommodation. Okay, you please look at my pen light and now look at the wall behind me. Okay, your positive accommodation reflex is intact as well. Now, just follow my pen light with just your eyes. Tell me when you see blurry or double vision.
Now.
Okay, convergence test is positive as well. I saw no nystagmus. Now we're going to test your EOMs. Just follow my pen light with just your eyes, not your head. I'm testing your EOMs, or I said that. Okay, we saw no nystagmus. Cranial nerves 3, 4, and 6 are intact. I'm going to continue and do a fundoscopic exam. Turning off the lights. Go in at 15-degree angles, same eye to your eye. Okay, red light reflex is intact. Optic disc appears sharp. Physiological cup is less than half the size. Macula has no discolorations. I don't see any retinal hemorrhaging. No opacities. Other eye. Okay, red light reflex is intact. Macula has no discoloration. Optic disc is sharp. Physiological cup is less than half the size. There's no retinal hemorrhaging. continue. Turn the lights back on. Now I'm gonna inspect your mouth. Can you smile for me? First I'm gonna do your nose. Can you close one nostril and take a breath in? Now the other one. Okay, your nerves are patterned bilaterally. And now I'm gonna look inside. I'm gonna test your smell first. Okay, close your eyes and cover one nostril. Okay, cover one nostril. Okay, tell me what you smell.
Alcohol.
Okay, keep your eyes closed. Cover the other nostril. Tell me what you smell.
Coffee.
Okay, cranial nerve 1 is intact. Your sense of smell is good. Now I'm going to look inside your nose. Go in the top. Right, I see no septal deviations, no perforation. It's pink and moist. No masses, no lesions, no erythema, no excessive drainage. Yeah. Other nostril. Okay, I don't see any septal deviation. There's no blockage or perforations. It's pink and moist. The mucosa is pink and moist. No redness, no erythema, no excessive drainage, no lesions, no polyps. Now I'm going to move on to your mouth. Your lips are pink. Can you smile? Your teeth, they're all there. No excessive, no bleeding in your gums. No receding gums. Can you open your mouth? Okay, say ah. I'm going to look with the light. And your tongue depressor. And check gag reflex. Okay, your gag reflex is positive. Cranial nerves 9 and 10 are intact. I'm going to keep looking. Mucosa is pink and moist. I don't see any exudates. Your tonsils are grade 1. Uvula is midline. Tongue is midline. Lift your tongue for me. Okay, mucosa is pink and moist. No lesions. No masses noted. And you're in the mouth. Can you please stick out your tongue? We're going to test cranial nerve 12. And lift it up and down and side to side. Okay, cranial nerve 12 is intact. We're going to move on to your ears now. Your auricles are symmetric in size. I don't see any visible lesions or masses. Now I'm going to palpate. Tell me if you feel any pain. I'm just going to palpate your tragus.
No pain.
And now your mastoid.
No pain.
Okay, now we're going to look inside. On your left ear, I'm going to pull up and back. Okay, cone of light is at 7 o'clock. There's no cerumen, no scarring. Tympanic membrane is fairly gray. No lesions, no redness, no masses. The malleus is visible. Now the other side. Up and back. Cone of light is at 5 o'clock on the right side. There's no excessive cerumen. Tympanic membrane is fairly gray. No scarring. No lesions, no masses. The malleus is visible. Now I'm going to test your hearing. Cranial nerve number 8. Please close your one ear. Oh God. Close one ear and close your eyes. Tell me what you hear.
1, 2, 3.
Now close the other ear. Keep your eyes closed. Tell me what you hear.
ABC.
Okay, your hearing is intact. Gross hearing is intact. Cranial nerve number 8 is intact. Now I'm going to The Weber test for any sensory neural hearing loss. Okay, tell me where you hear the sound, if it's on one side, both sides, or neither.
Both.
The Weber test. Okay, now the Rhine test, tell me when you stop hearing this on the mouse toy.
No. No.
On the other side on the mouse toy bone.
No. No.
Okay, so the Rhine test here showed that your air conduction is greater than your bone conduction, which is good. I'm gonna continue and inspect your neck. We don't see any trace of deviation. I'm just gonna palpate. Any pain or tenderness,
No
let
pain.
me know. Okay, your trachea is in line. Now I'm gonna palpate your thyroid. Please swallow. Okay, both lobes are symmetric bilaterally. Tell me if you feel any pain.
No
I
pain.
don't feel any nodules, okay? Now I'm gonna palpate your lymph nodes. I'm gonna start with preauricular. Tell me if you feel pain. Postauricular, occipital, superficial cervical, deep cervical, superficial cervical, deep cervical, posterior cervical, supraclavicular, your tonsillar, submandibular, submental. Any pain?
No pain.
Okay, now I'm just gonna inspect your neck and chest. Okay, you have normal respiration. EP to lateral is 1 to 2, that's normal. No accessory muscle use. Your skin, there's no cyanosis, no rashes, no redness. Now I'm gonna palpate. Tell me if you feel any pain.
No pain.
Now I'm gonna percuss. Okay, I heard resonance in all fields, lung fields. Now I'm gonna auscultate. Just take a deep breath when you feel my stethoscope. You start with the mucuses. Okay, I didn't hear any adaptation lung sounds. Can you please swing your legs over? I don't see any redness or rashes, lesions. Tell me, palpate. Tell me if you feel pain.
No pain.
Okay, take a deep breath in. Okay, so chest expansion is normal. I'm gonna, when you feel my hands, just say 99. I'm checking for tactile fragments for any consolidation.
99. 99. 99. 99. 99. 99.
Okay, I heard vibration symmetrically on both sides, no extra vibration, so there's no consolidation. I'm gonna percuss now. Okay, I heard resonance. Now we'll test for diaphragmatic excursion. Can you please take a deep breath and hold? Okay, I heard dullness here, so can you please exhale and all the way and hold? Okay, and I heard dullness about here, so that difference is about 3 to 4 centimeters, which is normal. Now I'm gonna auscultate. Deep breath. I didn't hear any adventitious lung sounds, so normal bed sounds are heard. When you feel my stethoscope, please say EEE. We're testing for agophony and consolidation.
EEE. 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 EEE.
Okay, I heard EEE, not ah, so that means you have no lung consolidation. Now for the whisper pectorally test, please whisper 1, 2, 3.
1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.
Yeah, all I heard was just muffled sounds, which is normal. You didn't have any lung consolidation. You can see that right now. Now we're gonna check your blood pressure. Just rest your arm. Okay, your blood pressure was 100/70. Now we're going to palpate through your radial pulse. Okay, it's just gonna measure. Okay, your radial pulse is 70. Now I'm going to auscultate your apical pulse. Just intercostal, midclavicular line. Just checking for pulse deficit. Okay, your apical pulse was 70 as well, so there's no pulse deficit. I'm just going to identify the cardiac landmarks. Now, will you please just lower the knees up. So first we're going to inspect them and identify. This is aortic, second intercostal space, right sternal border, second intercostal space, left sternal border is pulmonic, fourth intercostal space, left sternal border is tricuspid, and then fifth intercostal space, midclavicular line is the mitral. Now I'm going to palpate, tell me if you feel, any tenderness, aortic, any tenderness, pulmonic, tricuspid, and mitral. Okay, I didn't feel any heaves. Now we're just going to bring it back and we're going to inspect your carotid pulses and for JVD, and then it's going to continue. Oh, actually, sorry, let's listen first and then we'll do this subset. Okay, now I'm going to auscultate your heart with the diaphragm bell. Aortic, pulmonic, tricuspid, and midclavicular, mitral. Can you please just lean forward for me so I can do your okay? And we'll auscultate pickup. Okay, I don't hear any bruise or. Now I'm going to auscultate the other landmarks with my bell. So second intercostal, right sternal border, aortic, left second intercostal, pulmonic, tricuspid on the fourth, left, and mitral. Okay, I didn't hear any extra heart sounds or gallops at any point. Just normal heart sounds. This one and this two I heard. And then go back and do the same thing. 30 degrees. Can you please turn left for me? I don't see any jugular vein distension or any extra pulsations. I'm going to palpate your carotid. Any pain?
No.
Okay, it's 2 plus major. 2 plus bilaterally. I'm going to auscultate while you're lying down. Auscultate while you're lying down. 30 degrees. Aortic, pulmonic, fourth intercostal, left, sternal border, tricuspid, mitral. Okay, no extra heart sounds heard. Can you please lay on your left side to get the TMI? Fifth intercostal space, midclavicular line. And then I feel a light tapping, so that's normal. Okay, and you put this plate back. Okay. Just gonna take this out. Be more comfortable. I'm gonna palpate your brachial artery bilaterally. Okay, that's 2 plus. Radial. You could just relax. Okay, it's 2 plus. Femoral. It's 2 plus bilaterally. And then posterior tibial. 2 plus bilaterally. And then dorsalis pedis is 2 plus bilaterally. And then in your lower extremities, I don't feel any cool skin. It's just warm, normal to touch. There's no discoloration. Your toes, so I don't feel any clubbing. Do you feel any pain here? No, in your fingers. No clubbing, no cyanosis in your fingers either. And they feel warm to touch. Now let's inspect your abdomen. Okay, your abdomen is flat upon inspection. No visible masses or distension. I'm going to auscultate the major vessels with the bell to check for any bruit. Okay, abdominal aorta. Renal, bilateral. Iliac, bilateral. Femoral, bilateral. Okay, no bruit was heard. Now I'm going to auscultate your abdomen. I don't see any rashes or lesions either. I'll come into that. Right lower quadrant, checking for your bowel sounds. Okay. Right upper quadrant, left upper quadrant, left lower quadrant. Okay, it's a normal active bowel sound in all 4 quadrants. Now I'm going to percuss. Okay, I hear dullness in your right upper quadrant, which is normal. That's where your liver is. Tympani, 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 tympani. Okay, I hear tympani in all of the other quadrants. I'm going to percuss your liver now. So about, well, I'm going to go down first. Okay, I hear dullness for about 4 centimeters. I'm going down, that's normal. Okay, Okay, and then about 7 centimeters across, which is normal. Now for your spleen, can you take a deep breath? And then left upper quadrant, I hear timpani, which is normal because you shouldn't be able to percuss your spleen. Now I'm going to palpate for your liver. Okay, don't feel anything, so that means your liver is a normal size. And then in your spleen, your left upper quadrant, and then from behind. Don't feel anything either. Now I'm going to palpate all of the rest. Light palpations first. Tell me if you feel tenderness. Any tenderness when I palpated for your liver? No.
No.
Okay, good. Right upper quadrant, mid epigastric, periumbilical, left upper quadrant, left lower quadrant, suprapubic. Any pain? Okay, now a deep palpation. Tell me if you feel any pain. Right upper quadrant, mid epigastric, periumbilical, left upper, left lower, and then suprapubic. Any pain anywhere? Okay. We're gonna do let me check your TBH underneath. I'm gonna just strike your lower back. Tell me if you feel pain.
No. No.
Okay, no TBH underneath bilaterally. And your inguinal nerve. Tell me if you feel any pain.
No.
Okay, I don't feel anything, so that's good. You can stand up for me. We're gonna check your gait. Can you stand here? Walk that way 5 feet. Okay, I see normal gait. You have good balance. Now walk back. Okay. Now I'm just going to just stand in front of this space. I'm just inspecting your spine. And your back. Does muscles look like you have good tone? I don't see any excessive twitching. There's no visible atrophy. Can you please bend and touch your toes? Okay, I don't see any scoliosis, no kyphosis. Your spine is straight. Can you please bend side to side for me? Okay, and now bend backwards. Okay, you have full range of and now rotate at your hips. Okay, you have full range of motion in your spine, which is good. I'm gonna palpate the paraspinal muscles. Tell me if you feel any pains.
No.
Any pain?
No.
Okay, I don't feel any crepitus in your shoulders. Now for your neck, can you please put your chin to your chest? Now put your head backwards. Now bend your ears to your shoulders side to side. And now turn your head to the left. Okay, you have full range of motion in your neck. We're going to test your TMJ muscles. Tell me if you feel any pain. I'm just palpating your masseters.
No.
Okay, and now open your mouth, close your mouth, protrude your lower jaw a bit and retract it. Okay, your cranial nerve number 5 is intact. Now for your shoulders, can you please raise your arms forward and now behind you. Now to the side, yeah. Now, touch the back of your hands to your back of your back, and now touch your head with your hands. Okay, you have good flexion and extension in your shoulders, and internal and external rotation. Internal rotation. Okay, now we're gonna move on. Now I'm gonna palpate your arms. You have good tone, and your muscles are symmetric. Do you have any pain?
No.
Okay. Your elbows. Can you please touch your hands to your shoulders? Okay, good flexion. Now put them down. Good extension. Stick your arms out and put your hands, palms to the floor. Good pronation and then palms to good supination. So you have good range of motion in your elbows. Now for your wrists, fingers to the ceiling. And good flexion and extension. And then fingers outward. Okay, that's good. Abduction and towards you. Good adduction. Now we're gonna move on to your fingers. Can you please make a fist? And now open your hands. And now touch one finger to your thumb quickly. Okay, you have good range of motion in your fingers. I don't feel any nausea. You said no pain, right?
No pain.
Okay. Now let's move on to your hips. Can you please stick your leg in front of you and behind you? Everything you do with one leg, do with the other.
Sure.
Okay. Now, take good flexion and extension. Oh, sorry.
It's okay.
Okay. Now, can you please pick up your knee like this and bring it towards you? Okay. Good. External rotation and then out. A good internal rotation. Same with the other. Okay. Good. External, internal, and then you bend, flex, and extend your knee. Okay. On the other side. Okay, you have good range of motion in your knees as well. I'm just going to palpate your hips. Tell me if you feel any pain.
No pain.
Okay, your muscle tone feels normal and even. Any pain on your knees?
No pain.
Any pain on your ankles?
No pain.
On your feet?
No pain.
Okay, on your feet, can you please do put your so can you lay here?
Yes.
So put your soles of your feet, I don't know, good inversion, and then your feet, good eversion, and then dorsiflex, so toes, whole foot up, and then plantar flex. Now just with your toes, good, and then make a circle with your ankles. Okay, you have full range of motion in your ankles. Any pain? No pain? Okay. That's good. Now, let's check your mental status. Okay. Tell me again your name and your date of birth.
Alina Rabinovich, 6193.
You know what today's date is?
May 5th, 2025.
Do you know who the first president was?
George Washington.
Okay, and you have good remote memory, and now for recent memory we're going to ask you to just remember cat, dog, mouse, okay?
Cat, dog, mouse.
Now I'm going to check your speech. Please count back from 100 by tens.
190, 80, 70, 60, 50, 40, 30.
Okay, good. And then those three words I asked you before.
Cat, dog, mouse.
Okay, so times 3, you have a good remote and recent memory, and your speech is good. Before I forget, can you lie back? We'll test your muscle strength.
Sure.
I'm just gonna push as hard as you can with your arms. Okay, and now with your face. On the other side. Okay, 5 out of 5 on your bilateral arms and on your neck. And now push with your head. Okay, 5 out of 5 with your jaw. And then push as hard as you can. Okay, 5 out of 5 and with your feet. Okay, all extremities, 5 out of 5. And then now we're gonna do your pain. And tell me if you feel this and where?
Yes, my right arm.
And this?
Left arm. Right thigh. Left thigh.
Okay, and now we'll do a sharpen dull differentiation. And then after we'll check your reflexes. Okay, so close your eyes. This is going to be for sharp and this will be for dull. Tell me what you feel, okay?
Sharp. Dull. Sharp. Dull. Sharp. Dull. Sharp. Oh, sorry, dull. It felt a little sharp. It was a
it's
little
not
sharp.
so sharp.
No, it was. I felt dull.
Okay, well,
Sharp.
which one's more dull?
Dull.
Okay. Yeah, this is not so sharp, sorry. And then keep your eyes closed, open your hand. Oh, so sharp and dull differentiation was good. What is that in your hand?
A pen.
Okay, good. And then, do you feel this?
Yes.
Where?
Left arm.
Hmm?
Left arm.
Oh, interesting. That was your left arm. So left arm or left thumb?
Left arm.
Oh, okay. Close your eyes.
Mm-hmm.
Where you feel this?
Left leg. Right leg. Right arm.
Okay, light touch sensation is intact. Can you flex your shoulders for me? Okay, your cranial nerve 11 is also very strong and intact. Now we're gonna test your reflexes. And then we'll do a lumbar test. Okay, so first we'll do bicep. No. Tricep. Okay. Hurts?
No.
Okay, that was intact. Radial. Okay. Radial brachial. Okay. And this is bicep. Okay, that's good. Reflexes. And then tricep. Okay. That's good bilaterally for all of your extremity reflexes. Upper extremity, now we're going to do your patellar. Okay. Okay. And now your Achilles. Yeah, please break it. Maybe we'll towards this way. Okay, well, this way, this way. Okay, Achilles. Okay, so twitch, so it's intact. Okay, bilaterally your Achilles is intact, and now we'll do plantar. Well, actually, while you're standing, we'll do shift drift test. So close your eyes and stand against the wall, and stick your arms out and close your eyes, and we're just going to see if you move side to side or okay, so you didn't have any shift drift, so that's good. Can you please, while you're here, walk from here to there, heel to toe? Okay, you have good balance. And backwards, walk just on your tippy toes. Okay, you have good balance there too. And just go down with your heel on one foot, on your shin, sorry. Your heel to shin. Yeah. And the other leg. Okay. Good balance bilaterally. And now for the lumbar. Just close your eyes and keep your legs shoulder width apart and just stand. Don't stand against the wall, but just have the wall behind you so you don't fall. Okay, checking for 20 seconds. Okay, that's good. And now you can open your eyes, and we're just going to test your plantar. Sorry. I'm just going to swipe up. Across. Okay. Good. There's no reflex in direction. That's normal. Okay, and then that's just going to conclude our exam today. Any questions?
No, thank you.
Okay, thank you.